My name is Lyle Murphy, the founder of the Alternative to Med Center, and today we're going to be answering questions that our viewers and readers have about a drug called Clozaril, also known as Clozapine. The first question would be, why do so many doctors feel that Clozapine is the most effective medication for schizophrenia? Probably because it knocks out the symptoms the hardest. It's, it's not a great drug though. It has 5 different black box warnings, which are the strongest warning that the FDA can give for a drug. It's got 5 of them. So there's a lot of backbite from this medication. So a doctor calling it the best med is probably not thinking about the health concerns of their patient. They're thinking about the symptoms. Next question, is Clozapine a mood stabilizer? It's not classified as a mood stabilizer. It is classified as an antipsychotic. Now, will an antipsychotic stabilize your mood? Yes, but it's not a mood stabilizer like Depakote, Lamictal, or Abilify kind of medications. Next question, what are the worst side effects of Clozapine? To me, that question is a little bit like if you have a claw hammer or a ball peen hammer, which one is worse if you get hit in the head with it? They're all pretty bad, but as far as like the long-term life impact of the different real maladies that are possible from this type of drug, cardiac toxicity might be the worst one. This drug is known to have cardiac and cardiac failure from using this medication. It's not common, but poisoning your heart can certainly have long-term ramifications. There is another event called agranulocytosis, which means that you drop in your white blood cell count. That should come back if you stop using the medication, but it is another thing that could cause serious health concerns, especially if it's unchecked. And even though Clozapine is not on the top shelf for drugs that produce tardive dyskinesia, tardive dyskinesia it happens with atypical antipsychotics, and that has a pretty long-term effect, and that's the one that me personally I would want to acquire the least. I think the other two, even if the cardiac toxicity killed me, it probably would be better than having to deal with lifelong tardive dyskinesia, which is very disfiguring, very debilitating, and it's quite a cross to bear. Next question. Why is Clozapine called an atypical antipsychotic and not a benzodiazepine? Now, reading into this question a little bit, I'm thinking maybe people are confusing Clozapine with clonazepam. And that actually happens in the medical industry. Nurses oftentimes confuse these two meds because the pronunciation of them is very similar. So Clozapine, also known as Clozaril, is an atypical antipsychotic that acts on primarily the dopamine receptors. Clonazepam, also known as Clonopin, is a benzodiazepine that makes the synapse more permeable to GABA, which is an inhibitory neurotransmitter. So Clozapine is blocking a stimulatory neurochemical called dopamine. The other one is enhancing an inhibitory neurochemical called GABA. So they're both having a sedative effect, but on 2 completely different neurotransmitter pathways. Next question. Can Clozapine cause tremors? Any medication that's going to affect dopamine can give muscle movement problems, kind of even Parkinsonian type symptoms. The light tremors are pretty common with Clozapine, but one of the things you want to look for is a medication causing muscle stiffness and rigidity. Muscle stiffness and rigidity that feels like, especially if it's happening in your diaphragm, could be an allergic reaction to the medication, or could be the development of what's called akathisia or tardive dyskinesia even. So If you're having these type of symptoms, you definitely want to run it back by your doctor and just make sure that that it's not something more serious. Next question. What's next for the schizophrenics when clozapine fails? Doctors always seem to have another drug ready. Well, Clozaril is sort of the end of the line treatment for schizophrenics. And I guess it depends on what you mean by not working. If not working to control the psychiatric symptoms. Again, that's kind of the end of the line, Clozaril. If it's not working because the side effects are so bad, there's a lot lesser drugs that have lesser side effects that still may be able to control the psychiatric, the delusions and the psychosis. Sometimes they might use Invega injections rather than clozapine. But usually when somebody's gotten to the point of taking clozapine, they've had all of those other drugs, or at least a few of them. All right, next question. Could clozapine affect one's cognitive abilities? Well, let me go back to the question. So I'm imagining, somebody that asks this question might be like, I'm stuck here. There's holistic mechanisms. There's a large reason, like 75% of the cases we see here at Alternative Med Center, they had one of three things going on. Bad diet, especially a bad diet that did not control their blood sugar. They had blood sugar swings going all over the place. You can't live off Fruit Loops and expect your brain to work. Second thing is the use of marijuana. Some people just do not metabolize marijuana well. And if you're that person and it makes you psychotic, you got to stop the marijuana. Not saying that everyone has to, but there's certain phenotypes that cannot endure smoking marijuana. And the third thing is the overuse of stimulants. Even the ADHD medications can, for certain people, be a lead up to going psychotic. That's 75% of the reasons. So if people are working with that part of their life, if that's one of the reasons, that's your other alternative, to start dealing with those things. And then using high-dose vitamin C, niacin, lithium orotate, some of the other things that we recommend for psychosis might be your next step if you've gotten to the end of your trials with antipsychotics. Next question. Could clozapine affect one's cognitive abilities or IQ? Absolutely. These drugs are almost invariably going to woo. I mean, that's what they're meant to do, is to kind of bring down, and especially affecting the way you perceive reward in life. People who are on these medications are going to be less interested in going out on dates, less interested in going shopping, less interested in even playing video games or having a job. And they're going to look tranquilized. So yeah, absolutely, these drugs are tranquilizers and can affect your cognitive abilities. Some people can't even drive cars when they're on these type of medications because they're just not alert enough to be able to not get into a car accident. All right, next question. Is clozapine worth the risk of those suffering from severe schizophrenia, considering how dangerous some of the side effects are? That is a personal question. For me, generally no would be the answer. I think that antipsychotics are definitely the last line of intervention when it comes to treating psychosis. There's family dynamic therapies like open dialogue that, sometimes in a spiritual crisis or an emotional crisis, there's a lot of other factors going on, and just having everyone's voice in the room that has an influence on the particular person who's suffering can alleviate some of the external stress. And then there's a lot of internal stressors too. So I would run the gamut of integrative psychiatry, particularly focusing on the holistic methods before I stepped up to a drug like clozapine. I mean, clozapine is the type of drug you give someone who is an ongoing and persistent danger to themselves or others, so that you can cut that down. A lot of people with intermittent symptoms, they're having intermittent symptoms for a reason. If it's an intermittent symptom and it's working some of the time, then it's probably not broken. There's other physiological reasons why a person is symptomatic at certain times and not at others. And getting to the root of that is much better than being on lifelong antipsychotics, including clozapine. Next question. What antipsychotic is a good alternative to clozapine if you have to go a different route? Now, for a person to get put on clozapine, typically they have to have failed at least 2 other antipsychotics. So let's say they failed Seroquel and Risperdal, and they're still having psychotic symptoms. That's when they typically go to clozapine. So as far as a medication, that would be an alternative to that. There is a drug that I'm actually not that familiar with people who have taken it. It's called Simvax, and Simvax is a combination of olanzapine, which is Zyprexa, and fluoxetine, which is Prozac. So you've got an SSRI, which increases serotonin. Increasing serotonin also diminishes a person's impulsivity. So they're not as impulsive and act on impulsive things. Generally, the typical effect of Prozac is to diminish that impulsivity. And then you've also got another drug, olanzapine, which lowers dopamine and also will have the effect of reducing impulsivity. So those 2 together might be an option worth exploring. Just based on the pharmacokinetics of that combination, I would be interested myself if I were in this situation in learning more about. And it's not a very commonly prescribed drug. We don't see cases of that too much here at Alternative Med Center. And we haven't actually put anyone on it. So I don't have the firsthand experience from it to give you that kind of detail, but it's spelled SYMBYAX. And for the type of pharmacokinetics that it has, I think that it would be able to maybe have a little extra bonus at controlling some of those symptoms if they were really unmanageable in other ways. Next question. Why would someone be prescribed a therapeutic dose of clozapine? Well, hopefully they failed. Typically, when you get prescribed clozapine, you will have to have failed 2 other antipsychotics. So the therapeutic dosing would be to control antipsychotic symptoms after you've had 2 other drug failures from similar atypical antipsychotics. Next question, is olanzapine a better antipsychotic than clozapine if you worry about your physical health the most? They both have their problems, honestly, and various, I don't want to say benefits, but circumventions for certain problems. So the benefit to Zyprexa would be you don't have to check your white blood cells. Clozapine, you have to check your white blood cells because you could get the low white blood cell, what's called agranulocytosis. You don't have to do that with Zyprexa. Clozapine is probably going to eliminate the perception of reward and your vigor towards life, which is part of the actual therapeutic effect of clozapine, is to kind of bring the psychotics over perception of reward down to something that is, I guess you'd call manageable. Clozapine is going to have more of that effect, but the backbite of that is it robs you of your desire to even do life at all. Not that olanzapine, also known as Zyprexa, doesn't do that, but clozapine can be more impactful for that. And clozapine has less of an incidence as far as the research goes at producing tardive dyskinesia. In fact, some people that have tardive dyskinesia from taking Zyprexa have that tardive dyskinesia alleviated when taking clozapine, but they both have pretty heavy-duty impacts on physical health. And again, going to see a holistic doctor that can work with the functional way that your body works, even when you're on these medications, could be a good adjunct to help stabilize certain things so that you can then potentially get to a lower dose of the medication, or even maybe you don't need the medication at all. So yeah, working with an integrative doctor to bring in some of the other physiological things would be of interest to someone who is, primarily focused on the physical health ramifications of these drugs. Next question, which is less likely to cause tardive dyskinesia? Olanzapine, also known as Zyprexa, at 2.5 milligrams or Clozapine at 25 milligrams. As far as drug for drug, the olanzapine is more likely to cause tardive dyskinesia than the Clozapine, but this dosing range is quite low for both of those drugs. And so the possibility of developing tardive dyskinesia from either one of those at that dose is going to be rather low, but it'll be even slightly lower with the Clozapine. All right, next question. How long do antipsychotic withdrawal symptoms last? From 2 months. Sorry, there's a typos here. From 2 months at 100 milligrams of Clozapine. This is going to be really case by case dependent. 2 months would have a nominal to modest withdrawal profile. It kind of gets its hooks into you after about 3 months to 6 months. But again, if a person's really been highly symptomatic, coming off the medication, the likelihood of them becoming highly symptomatic again is very likely. So I would say on average it'd take about 2 months for a person to withdraw. But again, the real rubber hitting the road on this one is you do a withdrawal. So let's say you're on 100 milligrams of Clozapine and you go down to 75. You got to wait a couple to 3 weeks before you even see really the impact of that withdrawal. Like, you may think after 10 days you didn't have a withdrawal, you're fine. Well, it could happen even 2 to 3 weeks into this. So then if you're having symptoms, you have to wait for those symptoms to alleviate before you go to the next taper level. So that's really the guidepost. It's not like, oh, it's going to be a fixed 2 months or it's going to be a fixed 6 months. It's going to be based on how the person's navigating the withdrawal and how quickly they're able to move through it and feel stable and grounded again before they go into the next taper level. Next question. What are the chances of a low dose 25 milligrams of Clozapine causing tardive dyskinesia? Quite low. I mean, that's a very low dose of Clozapine. So I wouldn't say it would never happen, but it would be pretty rare. And I want you to think this is a safe drug. It just happens to be that milligram dose is very low. Next question. Does a significant weight loss change the efficacy of Clozapine? A lot of these medications are the dose dependent, has something to do with how much you weigh. So is the dosing range the same for a 110-pound female as opposed to a 300-pound male? It may take more to slow down the 300-pound male as far as dosing. So I would imagine, and this is sort of, I don't know if I have the completely researched answer to this question. I don't know if anyone does, but I would think that the lower the weight you are, the more effective the medication would be at the same range. So it probably would make it more effective if you lost weight. As far as controlling symptoms. All right, next question. Can hypomotility caused by Clozapine affect the absorption and efficacy of it? I'm imagining that what people are referring to here is that Clozapine is very known for giving people constipation. Constipation to the point where it can be fatal. I mean, literally die from fecal impaction and the toxicity that can result from that. So if you're having a lot of constipation from taking this medication, and then you take laxatives to move things through, then that could potentially decrease the absorption of the Clozapine. But I don't exactly know the answer to that question. If you're getting severe constipation from clozapine, this is something you want to bring up with your doctor, because it's not a good health profile to have chronic constipation. Now, another thing I think would maybe help in this spot would be high dose vitamin C, especially with some magnesium in it, because that's going to get you flowing in a natural way. And the vitamin C and the magnesium are going to both typically be therapeutic for the symptoms that the drug was treating, which would be the mania psychosis. Both of them will get your bowels generally moving and also will potentially reduce some of the symptomatology that a person was medicated for in the first place. So next question, will fasting for 24 hours affect the absorption of clozapine and cause a problem? If a person is having struggles with, like they're in and out of the hospital a lot, I wouldn't suggest fasting at all, because the blood sugar swings alone could take one of those maybe manageable situations and throw it into a place where it's now unmanageable. For a person who's been on long-term clozapine and been stable, and do they want to try fasting for 24 hours, which is very healthy for most people to do that intermittent fasting, I would think that it should not cause a problem with your with the absorption. And that actually concludes the questions we have on clozapine. People have been asking me to do a video on clozapine for a while, and I kind of hate this drug in many ways. It might be somewhat of an unfair judgment, because the people that I see on this medication are kind of the worst of the worst. I now have seen some people that have been able to come off clozapine in a similar way as the other antipsychotics, but this one is generally more challenging than the other antipsychotics. And I can't be exactly sure if it's the drug itself that's causing making it more challenging to navigate the withdrawal symptoms, or if it's the type of personality that gets put on these medications in the first place. I think that the type of person getting put on this medication in the first place is probably the larger factor, because, they've failed other medication treatments. And there is a big difference between someone who has intermittent psychosis and mania and someone who is constantly symptomatic. A constantly symptomatic person presents as someone who's hearing voices all of the time. They're making very loose associations all the time. They're paranoid all the time, and with all the time being the major highlight here. So there's a big difference between people who are symptomatic some of the time and people who are symptomatic all the time. And the people who get relief from the medications are typically the better candidates for using nutraceutical and other lifestyle ways to control those same symptoms. So if the medication is not controlling their symptoms, sometimes there's other problems going on. There might be a traumatic brain injury. There might be organic brain injury that medications aren't going to suddenly fix. So a lot of the people that come in on clozapine are it's sort of a concentration of those people who have much more stubborn factors in their symptomatology than just someone who has a bad diet. So that concludes our questions on clozapine. I do want to, as usual, tell the viewers that this is not medical advice. In order to, in medical advice, you're working with a medical provider who has a license in your state, and this is just information that you can run by your practitioner and have them view, or questions that you might bring up to them to further your information. I think that in any time when we're looking at a path that may have consequences, big consequences, like taking antipsychotics, we want to talk to not only the prescribers, the people that are licensed to talk about these sorts of things in a way that has, medical, the ability to create diagnoses and all that. But we want to talk with people who have experienced these type of medications and people who have been on them, to create sort of a composite perspective that helps us with making our decisions on these type of things. So I want to thank you for watching this video, and have a great day or evening, and we'll see you on the next video.